Hi, everyone. This is Robin, and I'm talking to Dr. Autumn Frandsen, who is a naturopathic doctor at National Integrated Health Associates, and she's going to be telling us a little bit about what she's speaking on at the conference. Hi, Dr. Frandsen.
Hi.
Thank you so much for joining me for a minute.
No problem. Thanks for having me.
So can you tell us a little bit about what you're going to be teaching us at the conference?
Yes, I'm going to be discussing how the incidence of cancer and how we can prevent it. And then I'm also going to be talking about what we can do in the event that cancer does arise. And some of that includes just putting people scaring them a little and then putting them at ease. Just some statistics about what the incidence of cancer is like these days and how most people, 1 in 1,000 people are actually cancer-free, even people who walk around and don't realize it. So just some things to boost up your immune system and some things to help with actually killing cancer once it does become out of control and our NK cells are not on top of it.
Did you say what was that statistic? 1 in 1,000 people are...
There was a study that was done, and it says that 500 to 1,000 new cancer cells are produced in healthy people every day. And asymptomatic adults, like people who aren't showing any signs of cancer and it's undetectable, only 1 in 1,000 actually does not have a single cancer cell.
Wow, right. I had heard that before, so that's why it's so important to have a strong body and a strong immune system, because everyone's producing these cells, but it depends on how you're living.
Mhm. Yeah. You have to set up. You have to make sure that you're setting yourself up to be able to defend against cells that have gone out of control and that are replicating too fast. And the best way to do that is, with the diet and lifestyle and just overall positive mental outlook and exercise. So there are a few other things that, are important. Stress is a major causal factor these days, and diet. And then, I'm just going to go over some ways that you can make sure that it's kept in check and that it doesn't affect the entirety of your body. And
Right. And you've been working with cancer patients for a while now, and you are probably going to share some stories and some examples with us, which will be exciting to hear.
Yes, and I'm actually going to talk a little bit about, the pros and cons of conventional versus alternative. I do have a lot of patients who come in the door, and they don't want to seek any kind of conventional medical treatment. And I'm very honest with them, and I try to point people in the right direction as far as which plan of attack to take, because there are some cancers you really you don't want to. They're very malignant and metastatic, and you don't want to take a chance with that. And then there's other types of cancer that, are very common and that can be easily treated at home or with, some alternative guidance.
Right. Well, I'm really looking forward to meeting you there. And I wanted to ask you one more question before we go. What are you looking forward to about this conference? Why are you looking forward to it?
Well, I'm looking forward to hearing all the other speakers talking about, just some simple things that we can do to better our lifestyle and make sure that we're, living a full and healthy life. And I'm also looking forward to sharing, some of my experiences with people who have gotten better and people who have a significant family history of cancer and who, remain cancer-free. I think I'm really excited about, giving some inspiration to people that think, that are fearful that they might end up with cancer.
Yeah, I think that's a really important piece of this. So, well, we're really happy to have you, and
thank you.
We'll see you in just a few weeks.
Okay, I'm looking forward to it.